My name is Tim Wingo. I'm a primary care and urgent care physician, owner of Atlas Healthcare located in Park West in Mount Pleasant. A direct pay practice is one in which the practice does not contract with third-party payers such as insurance companies. By not contracting with insurance companies and taking on the overhead associated with that, we're able to offer services for a fraction of the cost, yet spend a lot more time with our patients. I've set my prices to where it appeals to the masses. I'm the perfect practice for someone who doesn't have insurance, as I'm certainly going to be the most affordable, but I'm also the perfect person for someone with traditional private insurance in that I'm going to enable them to get a high deductible plan and save many times more in premiums than they could ever spend with me in a year. They have access to me pretty much 24/7. If they need me after hours, they can give me a call, as I have the office phone forwarded to my mobile phone. If they need me during the day and they need to be seen that same day because they have an urgent care complaint, they can get in and see me. If they're an established member of my practice and I know their medical history, their medications, their allergies, then we can actually do their acute care visits, many of their acute care visits or their follow-up visits over the phone, and then they don't have the inconvenience of fighting traffic, driving across town, or waiting hours in another facility. And it's going to be a fraction of the cost. I'm able to keep my costs low by avoiding all the costs associated with insurance contracts. I'm able to save hundreds of thousands of dollars a year in overhead, which allows me to see fewer people per day and spend more time per patient. What makes me different from other providers is that the other providers are going to usually be employed by large medical organizations. If you're employed by a large medical organization, you do not have an educated consumer who knows what they're going to need to be able to make an educated decision about what they need, and nor do they have any idea what the cost is going to be. The cost can vary from $100 for an ultrasound to a couple of $1,000s for an ultrasound. And depending on your insurance company or where you go to get that ultrasound done, that price can vary greatly. So therefore there's no true free market. If you remarry the consumer of healthcare to the payer of healthcare, then people will start to ask, do I really need that service? Do I really need that procedure? Where can I get it done for the least amount of money, since I'm going to be incurring more of the out-of-pocket costs? And by introducing the transparency that comes with free market competition, you actually will bring the price down and the quality up. My office hours are from 9 a.m. till 6 p.m. Monday through Thursday and 9 a.m. to 4 p.m. on Fridays.